Good morning, how are you? My name is Joyce Karanja. I'm a registered nurse here at CityHealth Hospital. So we had said that today we are going to have a talk, and today we are going to see on the immunizations of our babies, what to do, at what time, at what age, and how necessary and why we need it. So once the baby is born, definitely there are those vaccines we give on the first contact when the baby is born. This is the OPV, the oral polio, and the BCG. That is what we receive. Now this is, okay, to just clarify on this is what the government puts under, we call it the KP. So what the government says that every child should receive as per the schedule. So we'll first go with what the government says we should do in terms of immunization for our children. So at birth, that is where I was talking of OPV and BCG. This one should happen immediately the baby is born, but we make sure that the baby is at term, because at some point you might have a preterm baby and that baby is not viable or ready to receive the vaccine. So once the baby is good to go and no infections, no conditions that can limit us to give that vaccine, we go ahead and give it. So at birth, we do the OPV and the BCG. So after that, we give a span of another 6 weeks where the baby comes back to the clinic, and this time we are going to give the oral polio, and there were even campaigns on doing polio again. So it doesn't mean that once you had the baby given the vaccine at the scheduled time, at birth or at the 6 weeks or the 10 weeks, it doesn't mean we cannot revaccinate again. We get to those points where there's an outbreak of polio, and it has happened here in Nairobi, I think, quite often. So this is at least not new to us. So now at the time of 6 weeks, we'll now give we'll now start a new dose for pneumococcal vaccine. This one protects the baby from severe pneumonia. So when we say the baby is protected from pneumonia, it doesn't mean they will not get sick, but at least we have protected them at that little age, because we know under 5s are very prone to diseases, infections. Their immunity is a bit compromised because they are not yet get the antibodies to protect themselves at that point, and that is why these vaccines are very important. For 6 weeks, again, there is the other one we call pentavalent. This is a vaccine that has 5 components in it, especially for the respiratory conditions. And if there is a study that has been going on to say like why the babies are not so much taken away with the COVID, like what is that, is that because at this time most of these babies are being immunized, they are getting vaccines, and they are having these antibodies quite a lot, and that is why you can even find it with the COVID being a flu and a viral. In that case, it is the vaccines are a bit protecting them, because like for the pentavalent, it is specifically for the respiratory conditions. And if our baby has had that one, definitely we are at a good place to protect this baby. Then at the same times of 6 weeks, we introduce another one that we call Rota. Rota is a vaccine to protect from the rotavirus. This is a disease especially comes in through diarrheal diseases. So at that age where the baby starts picking things to the mouth, hygiene to some people, especially those in the slums or those in poverty-stricken areas. So the Rota really protects them, and you find that at this stage, rarely will you even find babies with those many diarrheal diseases if they have had the rotavirus. Still at 6 weeks, we are going to give, I had said oral polio, yes. Now the pneumococcal, the pentavalent, and the rota. Now we are talking about what KP, this is under the government schedule, what they give. At 10 weeks, we will still do the same as for the 6 weeks. But at 14 weeks, we will not now give the rota. We give rota only at 6 weeks and at 10 weeks, the rotavirus vaccine. Now at 14 weeks, we will now give the oral polio, we will now give the pentavalent, we will give the pneumococcal, and now give an oral polio, no, a polio vaccine, but now injecting. So the baby shall receive an oral polio and an injection for the same. So this is done at 14 weeks. So make sure that there are these booklets. Actually, they really help even you as a parent to know what is next for the baby, what has been done, what has not been done. And sometimes if the baby is sick, please make sure you tell the care provider before giving the vaccine. The baby has been having this 1, 2, 3. We don't give vaccine to sick babies, and we don't give vaccine to especially with those presenting with conditions with high fevers and all that. We don't give them until they get well. That is when we give. And then going on at other levels, like at 6 months, we'll have a vitamin A. So from birth to 14 weeks, that is where most of the vaccines are given to the babies. Then at 6 months, we'll have vitamin A. At 9 months, we will have measles vaccine. This is against, we call it the measles, mumps, and rubella vaccine. It protects the baby against that measles disease. At 1 year, we'll still have another vitamin A. Then at 1.5 years, we are going to have another measles and mumps rubella vaccine. And our baby will be fully immunized if we have done all that until to the 1.5 years. So make sure you follow that. Now for children who their parents was HIV positive, they are reactive, at 6 months, make sure that your baby will get measles vaccine. So measles vaccine, if a baby was born through a mother who is HIV positive, at 6 months the baby will get measles vaccine. At 9 months, the baby will get measles vaccine, and at 1.5 months, the baby will get a measles vaccine. Now there is a vaccine. This is new, and that's why we found it very necessary to have this talk. It's the HPV. HPV, it has, in the beginning, it got a lot of stories about it, and people are saying, no, that vaccine is not protecting our girls or our boys. Instead, it is making things worse. But to just say it from my point of view and the studies that have been done, it is actually a good vaccine to our children. And to just be so clean about it is that we are even giving boys the HPV vaccine. So what is HPV? HPV is the full name is human papilloma virus. So this virus, most of it is spread through sexual contact, the highest percentage. So the others can just occur within the environment and all that, but sexual contact is the one that takes the highest of it. So for this virus, it has been said so much it is affecting the women, but they also forget to protect the boy. So the vaccine that it's now ready, and it's both for the boys and the girls. So we will start our immunizations for the HPV at 9 years. 9 years to 14 years, this is the most effective part to give HPV vaccine, because most of this time, these children have not started being sexually active. And right now, at least things are really changed. You find girls quite young starting their sexual activities, and that is one of the reasons of getting HPV. If you started being sexually active at a very early age, you predispose yourself to HPV. If you have multiple sexual partners, you predispose yourself to HPV. A lot of smoking, maybe you are very chronic, a chain smoker, you predispose yourself to HPV. So the best thing to do is to have a vaccine, and at least we have had a vaccine. There is Gardasil. 9, and we have Cervarix. So these vaccines, they really protect the girls and the boys at this age between 9 and 14. You have your child with you at home, you'd want them to have this vaccine, please come and let us vaccinate them. Now talking of the other causes, there's this cancer. The reason why boys are included now, to just say it, HPV causes cancer of the mouth, there's cancer of the larynx, the throat, there's cancer of the anus, and this is for both because we have those organs with us. So let's not say HPV is only for the cervix, it's only for cancer of the cervix, cancer of the vulva, or cancer of the vagina. No, it is a whole lot to even both the boys and to the women. Only that HPV is more common to women than to men. You look at the percentages of those cancers, the specific, the mouth or the cervix or the throat, you find most of those high percentages go towards the women as opposed to men. But we still come to a conclusion that all of us need this vaccine. And it does not just come to 14 years, we can go up to 55 years of age when we are giving this vaccine. Only that we said it is most effective to those who have not had have not been sexually active, and that is why we are picking the ages of 9 to 14. So please have your child vaccinated. There are 2 doses, one at the first day of contact. So you come like today, you will receive the shot for HPV, then I'll give you a span of 6 months, you come for your second dose. But for those that are immunosuppressed, those with their immunity is quite a challenge, like we take the HIV positive kids, if they are there, those ones with shots, they'll have the shot. We take an example, like they come today, we'll have the shot today, then after a month you come back, have the second shot, then after 6 months you will now come back, have the third shot. This is for those with that are immune system, is why we give them 3 doses. But for healthy and good kids that have no issues with their health, 2 doses is enough, and you're fully protected with a HPV. Now there are these other vaccines that we and on about the HPV, it also protects against the genital warts, and this happens a lot to those that are immune system is a bit low, especially those with HIV. Most of them at the later they end up with this genital warts. Those are the most common, and HPV vaccine is such a good vaccine to protect them from such warts. So we have these other baby friendly vaccines. So these ones are not under KP, they are not under the government, but safe for your child. Now, like to start with the flu vaccine, the one that protects the baby against influenza, actually also good in pregnancy. When you're taking your tetanus shot, you can also take the flu shot. Like now the weather is quite headache for us, it's very cold. So if your baby has not received a flu shot and you find it necessary, please, you can come over and we can give it. We give it annually. You should not receive more than 1 shot every year. But if you want to follow the schedule for the flu shot, it starts at 5 months. That is where the baby will get the first flu shot against those flus, the influenzas now. There's the meningitis one. This one we start at 10 months. We will do it at 10 months and at 15 months. This is against meningitis. It is quite a serious infection, especially in children. It can kill within 24 hours. But if you're able to have your children receive this vaccine, it is very important, and it is going to protect your baby against the meningococcal disease. We also have the typhoid vaccine. This one we are going to, especially at this age, this baby is already walking, picking things from from the floors, eating, getting things from their friends, don't know how clean they are, and putting them in their mouth and eating all that. So the typhoid vaccine can really help us with when it comes to issues with hygiene, together with the cholera vaccine. If you're able to have your baby, I know there's so much to give to the baby, but we are really protecting our child at this point, because it's not just for today. A vaccine gives the body, the reason we give that vaccine, the body is able to get the antibodies against that disease, which is going to stay in the body for a very long time. So it's not just protecting the baby at that time, but even when the baby is a teenager or already grown up, those antibodies are still in the body to protect against that specific disease. We also have boosters for annual vaccinations. This one are now like the flu shots that we are talking about, that you give it annually. Every year that baby is eligible to have a flu shot. To catch up with those revaccinations, maybe you missed them, the baby was not able to receive them, like the typhoid vaccine. You can do one dose after every 3 years. That is if the baby was not able to do the schedule as per given by those vaccines. And then if also the baby could have missed the meningitis vaccine, we can do a recap between 3 months. If your baby is between that age gap and the baby did not receive the meningitis, we can do it at 2 doses 3 months apart. If the baby is between 9 months and 23 months, that is 2 years, 9 to 2 years, anything in between, and your baby did not receive like the meningitis vaccine, we can do it, and we will do 2 doses 3 months apart. Today, then after 3 months we give another shot. If your baby also missed like is beyond that year, the 2 years, now from 2 years to 55, now this one is like even to everyone, because I think most of us now are between that. It is 1 dose. 1 dose will be enough to protect you. That is between 2 years and 55 years. So don't say that you've missed the vaccine and it goes by. You can just come to the hospital and say, can we do a catch-up vaccine for this? And then we'll tell you this is what to do, because we will not take the baby back to 6 months and the baby is already 2 years. We'll not take the baby back to 1 year and the baby is like 3 years. What do we do at 3 years now? So that we will need to do a recap and do a schedule for that time that the baby has come. So when we talk about immunization, the reason why we even have this talk is that the number is going low. The mothers, the parents have really kept the babies at home and forgotten that they need to do their schedules for the vaccines. For the weighing, okay, we can in for weighing, maybe to just see how much they are adding. But if it is a time for vaccination, don't worry about the COVID. We are trying our level best to make sure our hospitals are clean, to make sure those handling the babies are in the right gears, and to make sure that the vaccines are also potent, because we cannot also give a vaccine that is maybe its packaging is wrong, or it has passed the ones that we call the VVMs. Whatever we give and whatever we are doing right now with this pandemic with us, now that we are told we don't know even how long it's going to last, let's make sure that we are keeping our babies on the right schedule according to the immunization calendar, because once you miss it, you actually predisposing that child more to even the COVID itself, because as we have said, there's this study showing that even by just looking at the numbers of those that are succumbing to COVID, rarely are you finding a child. We have heard of even 6-year-old being infected, but we have not heard of them dying. Why? Because at this time, with the vaccines that they are already receiving, they are quite a number, they are quite active, because they are still receiving more within that period and keeping the body at a good level to fight even that COVID. So let's not think like keeping the baby home, it's safe. No, it's not safe if that baby is not receiving the immunization, not receiving the vaccines that they should be getting. So just for any maybe inquiry you need to get from us, for anything you want to inquire in terms of maybe the baby friendly, in terms of maybe the meningococcal vaccines, the typhoid vaccines, the cholera vaccines, the flu vaccines, you'll just contact us and you'll be gladly help you and maybe tell you how to revaccinate, how to catch up with the vaccinations you missed, and keeping our babies healthy. So welcome to City Health. Come and meet us. We are a happy, big family, a big team, and we will make sure that your baby is healthy. Thank you.